joined by our investigative reporter, Melanie Woodrow. Melanie, this story is unbelievable to me. I think this is a game changer, if you will, because if you were to ask me when I give a steroid injection in the emergency department, if I knew where that medicine came from, I would tell you unequivocally that I don't. It comes from our Pyxis system. You know, I say I need a steroid injection, the nurse goes and retrieves the medicine, and you use it. To think that medicines are being created in these compounding facilities and not being regulated is frightening to me as a doctor.
Absolutely. I mean, there is some regulation, but the idea is that it's not held to the same level of standards and scrutiny as it would be if it was made by a drug manufacturer. There are certain FDA regulations that are in place there, and you heard this pharmacist say, it's not the spinal injection that's the problem. He's had 6 of them. It's the idea that you want to know where the drug is coming from, and people need to ask those questions. Patients need to ask their doctors, where did this drug come from? Was it tested for sterility and other factors? And is there a report that says this drug is clean?
And doctors are going to have to start asking those questions. You know, where did this medicine come from? You know, we have trusted our source of medications because big manufacturers are fully FDA regulated, correct?
Absolutely.
I find it fascinating in this story that he is a pharmacist who uses, he's a compounding pharmacist. He didn't even use steroid injections from a compounding facility.
He said that when he went in for his, he wanted to know if it was from a manufacturer, and had it not been available from a manufacturer, he said he would have had his compounding pharmacy make it. But the idea is, if you're having some other compounding pharmacy out there make it, and you don't know what regulations or what testing they're holding themselves accountable, you really don't know if it's safe. You don't know if the drug is clean.
And the reason these epidural injections are so very dangerous is they're done basically right at the spinal cord. And meningitis, if you look at this brief animation, the meninges surround your brain and spinal cord. They're membranes that encase your brain and spinal cord. If those become infected or inflamed, you can develop meningitis. And in this case, since the medications were basically growing a fungus, the patients receiving the injections, basically right next to their spine, developed this fungal meningitis, which can be extremely deadly because of where it was being injected. Now, steroid injections are given all over the place. You know, regular old musculoskeletal issues, you get a steroid injection to tamp down inflammation. This, to me, the reason it's a game changer is even if you read the reports of the surgeons who are doing these injections, because again, this is a specialized procedure only done by certain doctors. Even they admitted that they didn't know where these medicines were coming from. And so if I'm a patient, you mentioned asking the doctor, but where do we go from here?
Well, in the short term, the FDA and the CDC are conducting a multi-state investigation. In the long term, there are some lawmakers that are now out there that are calling for the FDA to exert greater control over these compounding pharmacies to make sure that something like this doesn't happen again.
We have a statement from the New England Compounding Center that you can find on our website, thedoctorstv.com.